than 3% of kids have some sort of scoliosis, adding up to more than 3 million new cases a year. June is Scoliosis Awareness Month, and here to talk about this condition is Dr. Christopher Redman. He's a pediatric orthopedic surgeon at the Children's Health Andrews Institute Spine Center. Dr. Redman, for those not familiar with this term, what does this condition mean?
So scoliosis is a curvature of the spine, and it's an abnormal curvature that can play a big role in someone's life. If the curve gets really large, it can impact their lungs, their heart, things like that. And it's something that we don't fully understand why it happens, but it's a curve that typically develops in a young age, typically in adolescence, and most commonly kind of in the ages of 10 to 15.
And what kind of signs or symptoms should parents be on the lookout for, and how is this diagnosed?
Sure. So scoliosis in itself is diagnosed basically on a clinical exam, but to really have the diagnosis, it requires an X-ray. It's based on a curvature greater than 10 degrees, is actually the definition. And so we have smaller curves that we consider spinal asymmetry, not really anything to be concerned about. But what we're looking at is we're looking at shoulder asymmetry, so one shoulder being higher than the other, or the trunk being asymmetric, where they're shifted to one side. And the common way to see it is actually how we screen them in schools, what's called the Adams forward bending test, and that's having someone bend over like they're touching their toes and looking for the ribs to be higher on one side versus the other.
Okay, and something we were talking about, you are debunking a myth, because when I was growing up, I heard that heavy backpacks, we carried a lot of books, that was a cause of scoliosis. That's not the case.
No, ma'am. The American Academy of Orthopedics actually came out and said that this is not a concern for scoliosis. I do always recommend using both straps on the backpack, as back pain's so common, and if we have it just on one side, it can lead to some back pain. So sharing that load between the shoulders is best.
And I would imagine treatment is very important. If left untreated, what could children be dealing with long term?
Yeah, so if left untreated, scoliosis can get bigger and bigger. So once you're done growing, most cases will stop getting bigger. So less than 10% of kids actually require any type of treatment. If it continues to get bigger, though, it can have large impact on the heart and lungs. And so it can decrease your volume of your lungs, things like that, that can lead to different problems later in life, such as pneumonia and things.
And what are some of the treatment options?
There are so many treatments. Again, mainly it's observation. So less than 10% of people actually require any type of treatment. The treatment's based on the age. So if the child's really young, well, you don't want to go and do a big surgery on the back that prevents it from growing any further. So there's different things from casting to constructs that allow the patient to continue to grow, to actual spinal fusions where we turn all the small bones of the back into one solid bone.
And we don't know exactly what causes it, but is it genetic?
Yes, ma'am. We think that there is a genetic component to it. We know that about 1/3 of patients do have some sort of family history of scoliosis. So if your family does have a history of scoliosis, it's really important that you get screened for that. The earlier that we can catch somebody with scoliosis, the earlier we can intervene with non-surgical treatments.
Dr. Redman, thank you so much for your time and for bringing awareness to this.
Appreciate
Ken?
it.
Yeah, thank you very much to the both of you.